Chest pain is one of the most unsettling sensations that the body can produce because the mind goes to one place immediately, and that is this my heart? And once that question appears, well, everything else seems to get so much louder. Today, we're going to try to slow this down a little bit and talk about how to recognize what your body is actually trying to signal you with or perhaps saying to you. I'm Nurse Healy. I've been a registered nurse and I've seen chest pain assessed in emergency rooms and clinics and quiet exam rooms, even. And over time, one thing has become very clear: chest pain is common, heart attacks, not as much. So, knowing how to tell the difference doesn't replace medical care, not in the least, but it does reduce your fear and improve your judgment. So, let's start with what matters the most. Chest pain requires urgent medical attention if it feels heavy or crushing and feels like it's squeezing it all, or it spreads to your arm or up into your jaw, your neck, and your back, and comes with shortness of breath and feeling like you can't get your breath and you're nauseated and feeling kind of sweaty all of a sudden. If any of this feels new or it's severe or anything like you've never felt before, if that's happening, don't try to analyze it and don't even wait for anything. Just seek medical attention right now. Heart-related pain is rarely ever subtle, and it tends to be consistent, progressive, and almost impossible to ignore. A far more common and far less dangerous cause of chest pain is muscle or chest wall strain. This type of pain is often referred to as it's sharp, or it feels like it's rather pinpoint, right? It worsens with movement, like any kind of twisting or when you have to take a deep breath. It's tender when you press on that particular area, and it can be easily linked to a recent muscle injury, and when you change your body position, it causes you that anguish, right? Or if you've possibly had a recent accident. Sometimes people have coughing spasms or fits, and that tends to affect the muscles as well. Generally, this is considered to be a structural pain and behaves the way muscles behave, and usually changes with movement or with any form of touch. That distinction really matters. Another frequent source of chest pain comes from the nervous system. This isn't imagined pain at all, it's real physiological activation. Some of the features include tightness or pressure that comes and goes, rapid heartbeat or fluttering sensations in your chest, shortness of breath without exertion, and you get lightheaded. You kind of feel tingling, and suddenly you get this overall sense of ill at ease or alarm. Symptoms generally peak quickly and then they fade off. This type of pain often appears at rest or during a stressful activity, some sort of stress in your life, and settles with reassurance or grounding. It can feel really intense, but it does not damage the heart. So let me go back to what we classified as grounding. And grounding was, if you haven't caught up on other episodes, grounding is when you take a look at 5 different objects in your room and you kind of go, okay, that's a lamp, that's a candle, that's the dog, and that's the picture of Uncle Frank, and whatever it is, and you kind of talk yourself and you slow yourself down that way. So I'm just explaining that quickly so you'd have an understanding what grounding is. One thing that people are generally never taught is chest pain is understood by its patterns, not by its intensity. Heart pain is typically consistent and linked to physical demand. Muscle pain is generally positional and reproducible. And nervous system pain, it fluctuates and then settles down. But your job isn't to diagnose yourself. It's to notice how the pain behaves. That awareness helps you respond instead of hit panic mode, So you should always speak with a healthcare provider if chest pain keeps cycling back or it affects your sleep and your work. It's altering your peace of mind. And especially if you have risk factors like high blood pressure or diabetes or you're a smoker. Look, when your body's telling you something just isn't right, getting checked is not a sign of weakness. That's very responsible self-care. Chest pain doesn't always mean danger, but it always deserves attention. Understanding your body reduces fear and restores a sense of self-control. Look, the information contained in this video, well, it does not provide personal medical advice, diagnosis, or any form of treatment, and should not replace a consultation with your own personal healthcare provider, so please do so. This channel isn't chasing engagement, and share it only if you think it would help someone else. Yep. It's that time. That's all the time we have for this episode. The sooner you understand what your body is trying to tell you, the sooner you can stop living in fear of it. Thank you for being here, and thank you for trusting me with your time.